The broadcast is now starting. All attendees are in listen-only mode.
Good evening, everyone. We'll be getting started here in about a minute or two. Just waiting for all of our attendees to hop on our webinar tonight, and then we'll go ahead and get started. Good evening, everyone, and welcome to our webinar tonight. Tonight's topic is the pharmacy's pursuit of provider status, and we welcome Michael Spira, APHA's senior lobbyist, who's working hard on Capitol Hill for us as student pharmacists and for all of the profession of pharmacy. We are very pleased to have him broadcasting from snowy DC. He has joined us this evening in his off time and looking to get us inspired about pursuing provider status, as well as naming some specific ways that we as student pharmacists and new practitioners can get involved with the provider status campaign. So before we get started with Michael Spira, we'll go through a few of the APHA webinar procedures. You have two ways to listen to this webinar. You can use the telephone by clicking Use Telephone, and that way it will provide you with a phone number to dial, an access code, and a PIN number so that you can hear all of the exciting things that we have to say this evening. Or you can listen via the mic and speakers from your computer. That will activate by simply clicking the Use Mic and Speakers, and you'll be able to listen to the webinar through your computer speakers. Following the bulk of the proceedings tonight, we will open it up for a question and answer session, and we do have the capability for you to be able to submit your questions. So we encourage you to use the toolbar by clicking the raised hand icon. At that point, we can unmute you and allow you to ask your question out loud, or throughout the portion of the procedure of the webinar tonight, you can submit your question by typing it into the question box of your control panel. Again, you do not have to wait till the end of the procedures in order to submit your questions. We will be able to kind of cultivate those throughout the bulk of the procedures, and then we'll be able to answer those towards the end. So we have a lot to get through, and Michael Spira is anxious to address the many people that are on our webinar tonight. So without further ado, I will hand it over to Michael Spira, our APHA senior lobbyist, working hard for us on Capitol Hill. Michael?
Thank you, Lauren. I appreciate that introduction, and I appreciate everyone joining us this evening for this webinar about provider status and how you can take steps to help push along our #1 priority. We have a lot to get through in a short amount of time, so I'm just going to get started right away. And please, we'll have plenty of time for questions. So yep, the opportunity is now. As we all know, we have our 2 bills in the House of Representatives and in the Senate. In the House, it's H.R. 592, and in the Senate, it's S314. Some people have already asked me prior, is this different than H.R. 4190? H.R. 592 is the same bill as H.R. 4190, and S314 is the same bill as the others. The reason it's a new number is that it's a new Congress, so we had to reintroduce the bill. The House bill, H.R. 592, we have the same champions. Actually, we added a champion. We have Mr. Guthrie, Butterfield, Young, and we added Mr. Kind of Wisconsin. On the Senate side, I'm pleased that we have Mr. Grassley of Iowa, Mr. Casey of Pennsylvania, Mr. Brown of Ohio, Mr. Kirk of Illinois. The 2 bills were introduced not even a month ago, And in the House, we're already over 40 co-sponsors, and in the Senate, we are at 6. So we are very happy about this, and the legislation, as you should all know, would amend the Social Security Act to recognize pharmacist services within Medicare Part B. The legislation itself would allow for state licensed pharmacists with a BS or PharM who have additional training and certificates, depending on state laws, to be recognized with Medicare Part B, as long as they follow the state scope of practice and practice in a medically underserved community. That means they're in a medically underserved area, medically underserved population, or HPSA, Health Professional Shortage Area, which literally means there are few, if any, physicians. And you might say, well, that's such a short and small criteria, it doesn't sound like a lot of us would be able to practice. And if you can see, I know it's not the largest map, but you can see all the different areas where pharmacists would be reimbursed for their services as long as they practice in a medically underserved community and follow that state scope of practice. It's a large amount of area that is covered by this definition, HRSA, which is part of HHS. And again, you can see again the pharmacists where these health professional shortage areas are. So it's not a limited number of pharmacists. Pharmacists would be able to practice to the top of their training in these medically underserved communities following a state scope of practice. And we focus a lot on the federal side, but APhA is also working with our state associations and looking at private payers, because regardless of federal, state, or private payer, to be on either of any of these teams, you really need to be in Medicare Part B, you need to be in that Social Security Act, because a lot of folks use that. So we are focused on all three buckets, federal, state, and private payer, and you can see those different areas where pharmacists are trying to get involved. There's growing support for pharmacist value on the healthcare team. You can see some of these articles that advocate for increasing pharmacist role in on the healthcare team. And there are other articles that we haven't added to this. It's a growing support system for our initiative. So be proud of your profession and the work that is being done. Pharmacy collaboration and provider status. So we being APhA, we're part of a coalition of pharmacy organizations and stakeholders that are working to promote patient access and coverage to pharmacist patient care services. The coalition has many goals: consumer patient access and coverage for pharmacist patient care services, inclusion of pharmacists as members of patient health care teams, and what this coalition, we're called the Patient Access to Pharmacist Care Coalition. And you can see here, a lot of you have probably seen a similar slide in the past, but you might notice now we're on 3 columns. I don't know if we were on 3 columns the last time. We're at almost 30 organizations that are part of this coalition. And it's a growing coalition. You can see it's not just pharmacy. We have Health Leadership Council. We have a variety of different groups, and the coalition is working to bring other groups into the fold. So it's a growing coalition. We want to make sure we have not just pharmacy as part of this coalition. So when the coalition, not just APhA, but when the coalition goes up to the Hill, we are receiving positive feedback, and you can tell that by the number of co-sponsors we had last year, 123 in just a short amount of time, and the amount of co-sponsors we have already accrued in even less than a month. So we get the questions we get are not new. The cost of the bill and what's it going to cost. What are the other healthcare groups saying, AMA, and our answers are the same. We know it's going to be cost, the bill, the way CBO, the Congressional Budget Office, scores items, but we are prepared to work with committees of jurisdiction to find a way to pay for this bill. But we all know, you guys know better than I, that when this bill becomes law, that money will be saved for the healthcare system, for the government, by keeping people out of hospitals, making sure patients take their medications correctly, and so on and so forth. So the next steps, this is the important part. How can you all get involved? So if If you haven't already done so, I would urge you to join the campaign as a supporter. You would get emails from Tom Menigan, our CEO. You would get emails from Government Affairs. You would get updates on where we stand, action steps that we'd like you to take, including asking you to send a letter to your representatives to support the legislation or thanking them if they have already supported the bill. And this can all be found on the Pharmacists Provide Care website, where you can see fact sheets, toolkits, videos, and much, much more. So I urge you, if you have not done this, please sign up as a supporter. You'll get the emails and go to the website, and you can see all the important information. So some key message points. And I know you guys know this better than I, but I just want to run through these because it's some good little bullets if you ever get the opportunity to speak with a staff or a representative. Access to health care is a real issue for patients, and who better than pharmacists to help? People on complex medications benefit from pharmacist services, and when pharmacists are on the patient's health care team, costs go down and quality improves. And with the successful passage of the legislation, it would be critical to our patients and the representatives' constituents. And we need you to get involved, like I said. Share your story. There's the website address, pharmacistprovidecare.com, where you can get plenty of information, plenty of things that you could do to help support the initiative. Additional action steps. Host a congressional member on campus or in your pharmacy. They love to do those things, but if you don't ask, they won't come. Work with your state association if you'd like to bring that member, or see what you can do within that state if they maybe have an initiative at the state level. Hold a town hall session for students, pharmacists, and other healthcare providers. Share information via social media, and support the Political Action Committee, APhA-PAC. The PAC supports our champions. So by you donating to APhA's Political Action Committee, we then in turn can make sure our champions, those 8 members of Congress, return to Congress to introduce our bills or to work on the next step of our bills after this bill passes. Because if they're not there, we then need to find a new champion and begin this whole process again if we're not able to succeed. Pharmacy's next steps. We've got to keep pharmacy united and unified. Might sound easier than done, but there could be hiccups along the way. But I feel very strong and confident that that won't occur. And like I said earlier, we're growing PAPC, and we want to make sure we have patient groups in there and other provider groups, and we will get there. Look at the congressional or agency areas of focus and what they value, and try to lessen the resistance of other healthcare providers. I mentioned before the AMA. Members of Congress ask about the AMA. And the AMA is aware of the legislation, and they are not opposing the bill. They're not supporting it, but they are not opposing the bill. And last year we had 2 physicians co-sponsor the bill, a Republican and a Democrat. And I believe we'll have both on the bill shortly. One already has co-sponsored, and we hope to have the other one in the coming weeks. So the AMA is always an ask as well as the cost of the legislation. And the cost, we have CBO, like I mentioned earlier, the Congressional Budget Office has not scored the bill, and we are not at that point. Other steps that we're looking to take advantage of state laws and actions within your state. And you can do that by working with your state associations. Continue to demonstrate the value, impacts on cost, quality, the patient outcomes. We all know, but we need to educate others. Highlight evidence and continue research. Data is important, but we want to make sure that it's not peer-reviewed literature. So keep doing what you're doing on that. And I know that was quick, and I apologize if it was too fast, but I want to make sure we have enough time for question and answers. And with that, Lauren, I'll kick it on back to you.
Thank you, Michael. I think that was an immensely comprehensive overview of the efforts on Capitol Hill for provider status. And we have gotten a few questions throughout the course of your talk, but I encourage those that are on here and have questions, to submit your questions to the chat box and or into the question box. And we'll be working with those questions as we work through the questions that we've gotten throughout the presentation. So to the first question, which I'll take this first one so Michael can have a breather here. Is webinar recorded? Yes, this webinar has been recorded or will be recorded and posted to pharmacists.com for your consumption later. So those new practitioners and those student pharmacists and pharmacists that may not have been able to join us tonight are still able to get this information. And you're able to contact Michael Spira with any of the questions that may not have been answered throughout this presentation or throughout the question and answer session. So Michael, to your first question, a lot of student pharmacists are going to be conducting state legislative days throughout the spring. It seems to be state legislative day season. And so are these the same messaging and same talking points that they can use on the state hills?
Great question. And you are more than welcome to use our materials, but I would encourage you very strongly to seek out the information from your state association, because legislation that we're advocating for at the federal level cannot be enacted in a state house, nor vice versa. Federal government cannot enact legislation that was introduced only at a state level. So I would encourage you to, or maybe your chapter advisors, deans, professors, etc., will do this for you, get the information that the state association is working with their state house on. Maybe there are bills they're advocating for, bills that are being introduced. And we're seeing a lot of provider status type legislation introduced in the differing states. So a lot of you, when your state legislative day occurs, will be advocating for provider status at some level. And you're more than welcome to bring up HR 592 or 314 at that time. Thank you for that question. Good question.
Excellent. And to continue on the messaging trend regarding the provider status message, what opposition have you heard from? What other groups out there are possibly opposing this bill? How are doctors and nurses feeling?
It's a great question, and I'm pleased publicly we have not heard any grumblings of any opposition. We worked hard, we as a coalition, we as APhA, to ensure that the bill was structured in such a way to meet the least resistance. And that's because we use state scope of practice. It was all services, all pharmacists, so on and so forth. I'm sure the doc groups and AMA, etc., would come out against it. But the state scope of practice, that's already been fought in the state. That's a battle that's already occurred within the states, and it's already been agreed upon by the varying groups, by state legislatures, and maybe courts, who knows. But so that allows us to minimize and negate any opposition to this point. This bill was introduced March of last year for the first time, and nobody came out opposing the bill. Now, not only do we have the same House bill, we have the Senate bill, and again, nobody's come out against it. We looked using the HPSA, the Health Professional Shortage Area, and that literally means what it sounds like. There's a shortage of health professionals in that area, so that means few, if any, physicians. So they're not there. Who better than pharmacists to fill that void, not to take over the role of the physician, but just to assist as part of the healthcare team. So to this point, we do not have any opposition, and at this point, I would expect no opposition. But this is Congress, this is Capitol Hill, you never know what might happen, but right now, we do not have any opposition. And like I mentioned earlier, we did have physician support of the bill last year, members of Congress who are physicians, and we already have one physician, Dr. Rowe of Tennessee, who has co-sponsored the bill, and we're hoping to get other physician members of Congress to co-sponsor the bill. So very good question.
Great. And so, Michael, to talk more about taking action, a student is interested in hosting a member on campus. How would they go about getting that process started? And is it an easy process?
It's not a difficult process, and we are here, we being APHA are here to help. Find some dates that you would like the member of Congress to visit. Look at the congressional calendar to see when Congress is in session, and you can do that by visiting house.gov or senate.gov and looking at the congressional calendar. We also have a toolkit on our website on how to do this, and I and the rest of the government affairs team are here to assist if you're interested in doing that. And you just have to reach out to the congressional office. I would encourage everyone and anyone to do that. They being members of Congress, enjoy interacting with their constituents, and they enjoy interacting with students, sometimes even more so. So there's a toolkit on our website. I would encourage you to take a look at it. Check out the congressional calendar, try to see some dates with School of Pharmacy, your deans, your professors, chapter advisors, to make sure you can do this. And we are, again, we being APHA are here to assist you in that endeavor, and I encourage everyone to take this initiative and invite your representative, invite your senator to your school, to your place of business. They have just as much fun as you do. You get some great pictures, you get a great experience, and hopefully we get some co-sponsors out of it. So again, information's on the website. We're here to help if and when you decide to do that. And I say hopefully if and not when. So I hope that answers the question. And again, information is on the website. Pharmacists provide care. And then, of course, there's always pharmacist.com.
Excellent. So, Michael, you mentioned the PAC, or the PAC, or the Political Action Committee. What exactly is that, very briefly, and how can we contribute to the PAC?
That's a great question. So I would hope for every chapter that's on the participating in the call, you're also participating in our Back the PAC campaign, where the chapters at the universities challenge each other to see which chapter can raise the most money for the PAC. The PAC is a political action committee, and what the PAC does is it accepts donations from members, APHA members. You have to be a member to donate to the PAC, and you cannot solicit. If you're hosting an event at your university, you cannot solicit non-members. You can only solicit members of APHA. And then the monies that you collect, you can donate to the chapter, to the PAC. And what the PAC does with the money is we support those that support us. So it's our champions, it's those that co-sponsor our bills, it's those that help us push our agenda in Congress, because it takes time to educate these members of Congress and their staff. And on the House side, they have to run for re-election every 2 years. And to do that, they need to raise money. And we educate them, and they support our initiatives. And so we want to make sure they stay in Congress, so we donate to their campaign. So again, the PAC is very important to provider status. Every dollar that APHA PAC, I should say, not APHA, every dollar that APHA PAC receives goes towards the provider status initiative. And so that means supporting our champions, supporting those that support the legislation, and assisting those that help push our bill through the legislative process. And I'll just reiterate, if your chapter is not currently involved in the Back the PAC campaign, I would strongly ask that you become involved in that, because those monies really go far in helping the provider status initiative.
Michael Spira, I'm glad you mentioned the Back the PAC. And to summarize, once again, it is It's a fundraising competition between schools and colleges of pharmacy across the country, and really who can raise the most money for the PAC. And so those new practitioners who are associated with any local college of pharmacy or can possibly go back and support their alma mater in their initiative, we've made it even easier this year with the text to donate. So a critical number is about to come through, and we're looking for you all to join in by texting to donate, and it's simply by texting action to 50155, and then you'll be able to follow the instructions to donate directly to the PAC. And at that point, you can designate which school or college of pharmacy you're associated with, and make sure that that school or college of pharmacy gets credit for that and their Back the PAC efforts. So back to the questions, Michael Spira.
Hey, Lauren, if I can just interrupt, if you wouldn't mind just repeating that number one more time, I want to make sure everyone received it. This is something that we're doing for the first time, the text to donate. We've never done that, so, you know, in 21st century, so everyone texts. So it's very simple, like Lauren just mentioned. So we would encourage you to use that new resource and tool at your fingertips and text to donate. So Lauren, if you wouldn't mind repeating that number one more time.
That number is 50155, and you'll be texting ACTION, A-C-T-I-O-N, to 50155 for the text to donate to the Back the PAC campaign. We have a few more questions for you, Michael, so before we let you off the hook. With regard to the fiscal note or the CBO, what process, at which point in the process are these two bills? When will they finally be scored?
It's a great question, and I appreciate the question. So we're at the point right now, the bill was just introduced the end of January, and we are going to gather as many co-sponsors as we can. So, and I'll get to the scoring in a second, but we're gathering as many co-sponsors as we can. So I would urge you, if you have yet to do so, check to see if your representative and senator has co-sponsored the bill. If they have, please send them a thank you note for their support of the bill and their support of the profession. If they have not co-sponsored the bill, again, you can go to Pharmacists Provide Care, and that website you can write, there's an icon in the top of the screen. You just click it, and it'll take you to already a pre-drafted letter that you can send to your representatives and senators. So please, if they've co-sponsored the bill, thank them. If they have not done so, please send them a letter urging them to support the bill. The letter's already written. You just have to put in your name and address. That way, the application can find who your representative is. So the scoring part of the question, so we're currently gathering co-sponsors. We hope sometime early summer, late summer, that the bill in both the House and the Senate is part of or a hearing, or it is a standalone hearing within the committees. And we will work with the champions, Mr. Guthrie on the House side and Mr. Grassley on the Senate side, about when the ideal time is to have the bill scored. And to be quite frank, maybe we don't have it scored because it gets part of it to be another initiative. But that's a larger question at this point. So right now the bill is not scored. It may have to be in the future, and we'll cross that bridge when we come to it. But odds are it will need to be scored, but we're not doing it right now. And if anyone asks you if the bill has been scored, the answer is no. We know there will be a cost, and we'll work to find an offset. So I hope that answers that question, and I can go into more detail, Lauren, if you think I need to.
I think you covered it very comprehensively. So to our next question, Michael, what type of information should be shared or can be shared on social media regarding the provider status campaign, and where would you suggest finding that information?
All the information is on that website, like I mentioned, Pharmacists Provide Care. Everything and anything. I encourage you to post on Facebook, HR592, S314. on Twitter, whatever you have at your fingertips. The coalition and APhA, we're pushing this out on social media. When you sign up to be a supporter, you'll receive information on, hey, we're pushing this out, send a text, send a tweet, post something on Facebook. So we are using social media, and a lot of that information you will receive if you have not yet signed up to be a supporter, and you will also see that information on that website.
Excellent. And to add to that answer, I know the APhA Facebook, as well as the APhA-ASP and the New Practitioner Network Facebook, all have excellent content that they are developing throughout every day and sending it out every day that can easily be shared on your personal profile or any groups that you very well may be involved with. So I encourage you to follow APhA, APhA-ASP, or the New Practitioner Network in order to stay connected with those resources and that information so that it can easily be shared. So Michael Spira, one of the final questions here, for student pharmacists or new practitioners who are not able to get to their legislator's office in DC, is it effective to meet with staff in their district offices?
It's a great question. Great question. Thank you, whomever asked that. So I'm a former staffer. I worked on Capitol Hill for 10 years. And it was always great when people from my hometown or from the congressional district came to visit us and came to meet with us. But it's not necessary. When you come down to D.C., if you're coming for SLI, if you're coming for another reason, we're happy to help set up Hill visits. But every member of Congress, House and Senate, have district offices for many reasons. One of those reasons is for meetings. So you are encouraged, not just by me, but by those offices. They like when people come and meet with them. And you can find out the district office telephone number on the congressional members' website and set up meetings with them. And the district office and the D.C. office, they share information. So the information will get to the D.C. office. And when you host a member of Congress at your place of business or at your chapter, you'd be working with that district office. And you can also do this online when you go to our website to urge your representative or senator to co-sponsor the bill. That's on our website. That goes to D.C. But as far as the district office, I encourage you, the office encourages it, that you meet there, and it's a fantastic thing. Get a group together and meet with that individual and form that relationship, build your network, because this is going to be a team effort in getting this bill across the finish line. So very good question. Thank you.
Very good. So Michael, that is about the end of our time tonight, and we have a few summary points to cover prior to closing. So any final questions, throw them in the question box, and as we close up here, so we can either follow up with you or answer it very briefly. But Michael Spira, thank you for joining us tonight and offering us all of this very informative information. A few points here. You can join the Back the Pack campaign in many ways, as Michael Spira has mentioned. And you can follow the link there to pharmacistsprovide.care.com. Pharmacists, new practitioners, and student pharmacists can also join the Back the Pack campaign by either texting to donate or finding the campaign at your chapter. You can also engage in the Policy Postcard Challenge. This is an event that has been spread year-round this year in order to where you can contact your legislators via a postcard. We have a template online on pharmacist.com in the Policy Vice President Toolkit where you can print out the template for that, bring these postcards to patient care events, and really impact patients. Once you have spoken to patients, really engaged with the patient, ask them to write that testimony down onto that postcard and send it to their legislator for them. And ultimately, the profession is viewed differently once a legislator is able to see how you have impacted patients and how patients are being impacted by pharmacists. At the end of the year, we'll be able to tally up those postcards that have been submitted, and your chapter is eligible to win the top prize for the greatest number of postcards submitted and sent in to the legislators. So more information about the Policy Postcard Challenge is available in the Policy Vice President Toolkit on pharmacist.com. But again, we have quite a few ways to get involved with the Pharmacists Provide Care campaign as student pharmacists, pharmacists, and new practitioners. I highly encourage you to get involved with the campaign in whichever way you feel comfortable, whether it be inviting a legislator to your college or school of pharmacy, or by simply sharing something about great content from any one of the Facebook pages regarding Pharmacists Provide Care. So with that, we'll close for the night, and we'll once again thank Michael Spira for joining us, and we'll hopefully be seeing you all in San Diego in roughly 6 weeks.